Good afternoon, and welcome to the Healthy Habits webinar series, which is taking place every other Thursday from June 17th through September 23rd from 12 to 12:50 p.m. We are so excited to have you all here with us today and so pleased with the turnout. We are expecting over 500 participants on this webinar. I'm Julie Chabdi, Health and Wellbeing Program Manager with the Center for Work and Family Life. And it's such a pleasure to spend the next 50 minutes with all of you. Just a few housekeeping items before we get started. We would like to invite you all to stand if you're able and stretch any time during today's presentation. So feel free to get up, move around, and shake it out. Your audio is muted to minimize background noise until we open it up for Q&A. But feel free to use the chat function at any time to make comments or ask questions, and our presenters will assist in responding. This webinar is being recorded and will be archived and shared on the Healthy Habits webinar page that you use to register for this series. The current pandemic has disrupted our lives in so many ways. USC faculty and staff have spent the last year and more adjusting to a new norm of working, learning, and living at home. We understand and acknowledge that this is a difficult and ever-changing time for all of us. With the return to campus activities this fall, many of us are faced with emerging challenges to maintain our current work and personal life routines, healthy habits, schedules, and environment. Whether you'll be returning in person this fall, have started the transition in the next few weeks, working a hybrid schedule, a remote schedule, or have been on campus this entire time, we want to provide you with information and motivation to create and maintain healthy habits. This series aims to support the health and well-being of our entire campus community by providing strategies and resources to help you navigate through the transition and recovery of pandemic life and continue and establish healthy habits that will last a lifetime. Here's a look at our 8-session webinar series. Today's session is on workplace safety, hygiene, and office setup, a very timely topic and one that is constantly changing and evolving as we navigate the challenges and transition of our work, workforce, and workplace this coming fall. We hope you'll attend other sessions as well. So let's get started with today's topic, workplace safety, hygiene, and office setup. Today's agenda will include a brief introduction on the program, services, and expertise provided by the Office of Environmental Health and Safety, updates and information on returning to campus and healthy habits we need to keep in mind, and then wrapping up with ergonomic practices as we plan to reset up our offices or need a reminder about setting up our current office. So with that, I'm very honored to introduce our presenters for today. We have Angela Christopher, Occupational Health and Safety Supervisor with EH&S, Carla Hill, Employee Health Program Manager with EH&S, and Marissa Marchioni, Assistant Clinical Professor of Occupational Therapy. I will now turn it over to Angela to kick us off.
Thanks, Julie. Hello, everyone. It's really nice to have you participate in our webinar today. I have been with USC for 29 years, and my whole 29 years have been with the Office of Environmental Health and Safety. So just to give you an overview of EH&S, our office is committed to the health and safety of all of the employees and students in our campus community. We promote health and wellness. We create a safe work and learning environment and support new and existing research activities. Essentially, our role is translate to regulatory agencies and regulations and making sure that we're following USC policies. So we are heavily regulated, our department with research, Cal OSHA, and other regulatory agencies, as you might imagine. So just a little bit about some of our programs and services. We have injury prevention and occupational health, and those programs are to protect the university community and to make sure that we improve our occupational health, research, education, and living environment. We have industrial hygiene program where we anticipate and recognize and do evaluations to control potential workplace hazards. We have a new cart safety program where authorized drivers are required to complete not only driving defensively, which is on Trojan Learn, but also our cart safety training. And those of you who have carts in your department or have people that are authorized to drive them will be in contact with you soon. In our research safety, we have our lab safety and controlled substances, biological safety, and we do have a BSL level 3 here on campus in our select agents program, and also our radiation safety and laser safety. Our hazmat services and environmental compliance, so we have waste management, clean up spills, do lab moves, closeouts, and other lots of other duties. And finally, we have our shop safety, which is a general safety management of all of our shops across our campus to make sure that we have an injury-free and accident-free shop. Now, next slide, please. All right, so our responsibilities as a department is training, and that's providing training and our annual refreshers. We conduct inspections and risk assessments. We've done a lot of risk assessments during the COVID stage to make sure that buildings and areas that you work in are safe to occupy. Our safety programs, we develop and implement different safety programs in accordance with Cal OSHA, Center for Disease Control, Los Angeles County Department of Public Health, and there are others. Emergency response and investigations. Unfortunately, there are injuries and illnesses and near misses that happen, and we investigate to prevent those things from happening in the future. Our hazardous waste team picks up spills and releases and also provide preventative measures. Our campus safety committees, we participate in IBC, which is Institutional Biosafety Committee, our RSOC, which is Research Safety Oversight Committee, our Radiation Safety Committee, our Institutional Animal Care and Youth Committee, and there are other committees. Consultations and technical support, so there may be mold concerns, indoor air quality, and other safety-related matters that we will talk to you about, come over to your area and do samples and making sure that you are a satisfied customer. We have 2 offices here at USC, the University Park campus. We are in the Cal building. And then at the Health Science campus, we are in the Soto building. It's a single-story building. We have approximately 40 employees between the 2 campuses, and our director, Deanna Willis, has been intimately involved with all the COVID since the pandemic started, working with the Health Center and other groups to provide guidance and consultation. If you'd like to see more information regarding our programs and services, please feel free to visit our website at ehns.usc.edu, or you can email any questions or concerns to ehs@usc.edu. Now I'd like to introduce Carla, who is also part of EH&S. She's a new employee involved in the new program here, and I'd like for her to take the floor. Carla.
Thank you so much, Angela. Hi, everyone. My name is Carla Hill. I also work in the Office of Environmental Health and Safety. I am part of the Public Health Division, and I am your Employee Health Program Manager. It is a pleasure to be invited to this Healthy Habit webinar series. Today, I would like to go over a few important resources on our website and discuss vaccine requirements. After that, I will go over some healthy habits that we will want to adopt when we return to campus. So let's go to this website. Hold on one second. First, I would like to draw your attention to our website. located at ehns.usc.edu, and the COVID-19 safety resource page linked at the bottom. There's a lot of information here, and it's a great place to start with any questions about COVID and working at USC. USC has taken a phased approach to returning to campus, which allows us to gradually restart activities while also enable us to dial things back if needed. Next slide. Here's the USC reopening guidelines. One of the resources there in this page is detailing USC reopening guidelines for different areas and different activities. You can use this page by selecting your area of interest on the left-hand side. I believe general health and safety will be selected by default, but go ahead and click on the topic you have questions about. If you're looking for cleaning guidance like me, you would simply click the box next to cleaning. If you look at the building readiness section of our COVID-19 information, you can find information about each building on campus. When a building is listed as ready, it meets and exceeds the minimum requirements of 5 very important things: air changes guidelines, outside air ventilation, air filtration guidelines, water flushing guidelines, and cleaning guidelines for the university. Of course, this is based on the space and usage. You can navigate to the building or location you work to ensure that your building meets these new building readiness criteria. Next slide. As you're aware, all new employees are required to be vaccinated against COVID-19. So I implore each and one of you, if you don't have a religious or medical exemption, please go ahead and get your vaccine as soon as possible. The goal at USC is to become a fully vaccinated campus. To get there, USC's policy states that 1, everyone must be compliant with the COVID-19 vaccination. Compliant means that you have received a vaccine with FDA authorization or emergency use authorization, or one is approved by the WHO, the World Health Organization. Next, USC requires each of us to upload a proof of our vaccination, and that was due on July 15th. I hope you already done that. Okay, we all know that there's going to be exceptions, medical and religious. For those with a valid medical or religious reasons for not being vaccinated, they need to have an exception approved by USC after August 1st. Those with exceptions will be required to complete weekly COVID-19 tests and will be subject to additional requirements. Next slide. So, USC employees will need to upload verification of vaccines through My SHR portal. You can log into this portal with your USC credentials. Just navigate to the USC Student Health website and log in. A login button will be on the front page. Please note that if you received your COVID vaccine at any USC pharmacy or healthcare facility, or any of the events that we had on campus, your information is already uploaded for you. As you may see towards the bottom of the screen, the My SHR portal is also where you would upload the request for religious or medical exemption. Please note that as of August 1st, personal declinations will no longer be valid or accepted. Now that we have that out of the way, I would like to address what many of us are wondering. What will things be like when I come back to the office? What should I do to protect myself or others? Well, CDC recommends a layer approach to reduce exposure to COVID-19. This means not just wearing a mask or just washing your hands, but doing many things which together provide excellent protection. USC is doing its part, implementing multiple mitigation policies and activities, but a lot of the burden to protect ourselves still falls on us. All employees visiting campus locations are required to first have completed the Health and Hygiene Safety Training class in the Trunja Learn system. In addition, Before each visit to campus, everyone must complete their Trojan check and submit reservation for each building they plan to visit that day. The Trojan Check is an online wellness assessment found at trojancheckus.usc.edu. I want to stress the importance of completing your Trojan checks. We need to make this your new habit. So this is my plea. If you have a sore throat, runny nose, congestion, or fever, headache, and you need to stay home and isolate and get tested. The reason I say this is right now at USC, almost all the new COVID cases with vaccinated or unvaccinated alike, they all think they may have just a little cold or a little allergy, and sometimes it goes away. And this is when there's an exposure, when people come in with cold symptoms but really have COVID. And yes, this can even happen with vaccinated people. So again, please complete your Trojan check every day and be mindful of your symptoms. Masking. I know masking opinions vary, even among healthcare officials, but USC policy incorporates Los Angeles Public Health, Cal OSHA, and CDC guidelines. So what are the mask rules on campus? 1, regardless of vaccination status, masks and face coverings are required in all indoor settings. Exceptions include being in a private area with a closed door or eating or drinking while maintaining a 6 feet distance. Mask face coverings are no longer required in outdoor settings. USC will also provide N95 masks to employees and faculty for voluntary use upon request. Face shields are not a replacement for face covering, but when used together, offer additional protection. Now, what is a face covering exactly? A face covering does not include scarf, ski mask, bandana, turtleneck, collar, or a single layer of fabric. Instead, face coverings means a surgical mask, a medical procedure mask, a respirator, or a tightly woven fabric or non-woven material of at least 2 layers. A face covering has no visible holes or openings and must cover the nose and mouth. Well, you might have heard that physical distance requirements are gone, but they're really not gone for those that are not vaccinated. So as you can see here, if we can adhere to USC policies on mask, distancing, and the vaccine requirements, we spoke about it before, if we do this, we will safely be able to return to the campus to normal operations at 100% capacity. Right now, we are in phase 5, and as you can tell, in-person instructions are back and they're open at 100%. Athletics and fitness is open at 100%. Next slide. Next, I want to remind you not to let your guard down. Restrictions have been loosening and hopefully will continue to do so, but that doesn't mean that everything is fine and now COVID is over. We should continue to embrace best practices like washing our hands, avoid touching our faces, and sanitizing common spaces and equipment. Keep sanitizers and disinfectant wipes handy. People with hotel space. And by that, I mean sharing a cubicle or office with one or more or other employees. Please work with the other person in your share space to develop a hygiene regimen. This is something you can also work with your supervisor. So that way you can all feel safe knowing that things are kept clean and decontaminated properly. Supervisors, please provide disinfectant wipes for AV equipment, copy machines, and other office equipment that the staff shares so that they can be sanitized between use. And also, please provide your employees the sufficient time they will need to complete hygiene practices and health checks. For now, my suggestion is to avoid crowded people close together, especially indoors. And it's probably time to start really paying attention to those room capacity signs. Our old ways of doing things might not be appropriate in the midst of this pandemic. Please be open-minded and not afraid to tell your supervisor if you feel like an activity might be unsafe. I also want to make sure all of you leave here knowing that we're not just here to offer your help over a webinar. EHS is your partner, and we are here to help. Please reach out to us if you have an unusual circumstances or issues at your work location, and we'd be happy to help. Please take care of yourselves and fight on. With that, I would like to give you attention and introduce you to Professor Marchioni. Thank you.
Hello, everyone. I am overjoyed to get to share this time with you and talk to you about the physical workspace and how you might help yourself to be healthier, create new habits as things may be changing and transitioning, and keep your body safe and well. So at first, I want to just acknowledge that working at the office is different. It's a different physical space. Certainly a lot of things may change no matter where it is that you're working from as we adjust to working from home for longer, or perhaps we adjust to returning to the office full time or doing some sort of hybrid version of working. And notably, some of those things that might be different as we return to the office are things like navigating the social environment and other people that you may not be working side by side with unless you're at the office. So one of the major differences is that the environment at the office is set up for the intention of work, and it could be that you're still working from home and trying to pull things together in a way that would be supportive. And then different things are within more direct or less direct control when we're working in a shared environment versus the personal environment of our homes. So some things to consider is that if you are moving into a hybrid working model, you might need different equipment. Perhaps you had a setup that was working well or maybe not as well at home, and you might need some equipment for home as well as some equipment for the office. It also might be that if you're sharing environments there at work, that you might share equipment at work. And so your attention to how you enter that space might need to be a little bit different. So if you were working at home and now you're transitioning back to the office and you found some things that worked well for you at home, I encourage you to try to translate some of those adjustments as you move back into the office. Next slide. Thanks. So some of the things that I'm going to encourage you to pay attention to, much like Carla was encouraging us to pay attention to if you notice any symptoms within your body around the idea of having a little bit of a sore throat or headache or any of those signs and symptoms, we want to pay attention to the other body's warning signs that something might be wrong. And these early warning signs can tell us when we might need to make an adjustment in order to be more comfortable and prevent the risk of a repetitive stress injury. So here on the slide are the most common signs, those early warning signs that something isn't quite the right fit. Now, all of these early warning signs are indicators that you might be exposed to some sort of a risk factor. Next slide. Here on this slide, I have listed ergonomic risk factors. These are factors when your body is interfacing with a physical environment, and they're indicator that there might be some risk to your tissues. So the first of these ergonomic risk factors that probably is pretty intuitive is the use of force. Maybe a little bit less intuitive if your work is primarily computer-based, because certainly we don't think of working on a computer as being physically forceful, unless you happen to be one of those people who type with a lot of passion. But certainly that is one of the ergonomic risk factors. The second is awkward postures, which I'm going to spend a good amount of time talking about today, just so you can check in with your body. And that's anytime that we are feeling unsupported in our seating, that we're unable to maintain nice neutral positionings of our body, anytime that we feel really cramped in our physical space, any of those things can contribute to repetitive strain. And much as the name suggests, repetition also contributes to repetitive strain. And while this may seem pretty intuitive, sometimes very similar movements, even if they're not exactly the same, can contribute to repetition. Next is contact stress. And really this means anytime that any of your soft tissues makes contact with hard surfaces or surfaces with a lot of textural friction that might come into contact with your skin. This happens a lot when we lean. So sometimes that might be on your work surface. You may lean forward as you're contemplating. You may lean to one side as you start to become fatigued. And any of those points of contact might decrease the blood flow and impede the nutrient pathway, causing our tissues to be a little less happy with us. And the final risk factor that I want to call everyone's attention to is vibration. Now, vibration often happens in forms of work where we're handling things like heavy machinery or hand tools, but it can also happen if we are working on an unstable surface. It can create a little bit of bounce, and that little bit of bounce actually decreases blood flow into an area. It starts to shift the blood out of that area, and again, your tissues become hungry. All right, next slide. So now that we know our ergonomic risk factors, I'm going to encourage you to check in with yourself. Now, before I go step by step, point by point, and all the things that I want you to check in on, if you haven't moved during the webinar so far, I am encouraging you and reminding you that now is a perfect time. We're about midway, and now is a perfect time to get up, stretch, respond to any of those bodily cues that you might have gotten, any faint tugging or nagging feeling of achiness. Go ahead and respond to that cue and give yourself a quick stretch. That might look like dropping one ear to one shoulder. It could be a nice over the head reach with a full body side stretch. And if you feel like it, go ahead and get up, get the wiggles out, shake your legs out, get some blood flowing. All right, well, once you return to your seats, if you happen to be in a space that you typically work, go ahead and evaluate the space that you're in. And if you're not, then take these things, pack them in your back pocket, and carry them forward with you as you transition into whatever space it is that you find yourself working in the future. All right, the first checkpoint is that we want both feet to be able to be flat on the floor or some other supportive surface. So that might be a time where, if your feet don't quite reach, maybe you find a box, a book, or you acquire a footrest. So we want both feet supported. And then I'm going to have you check in with each of the joints of your lower extremities. So take a quick peek or feel for your ankle, your knee, and at your hip. And each of those should be at about 90 degrees, setting your pelvis up in a nice neutral position with your sit bones firmly planted underneath you. And once you have a nice stable sit, then I want you to draw that spine of yours nice and long and tall. You might even imagine that your spine is like a string of pearls, and you want to draw that string of pearls up by the crown of your head. Oh, that was a good check-in for me. I can feel that I'm stacked now and I have a little bit less muscular stress. So the last thing and the hardest thing to check sometimes is your head and neck position. It's a little bit difficult because I can't ask you to look at your head and neck because your eyeballs are situated within them, unless you're using your camera or a mirror or something. But for every inch that your head moves forward, it's approximately 10 pounds of load that is added onto all the muscles here at the back of the neck and your upper back. Of course, that load is also displaced in other places in your body, and it's not exactly 10 pounds, but it's a nice rule of thumb. So make sure that that head and neck is stacked such that your ear is placed over your shoulder. You can imagine like your head is like a bowling ball poised on a golf tee. A golf ball on a golf tee. I'll talk about a bowling ball later. And any moment that your golf ball would start to roll forward of that tee is a minute that those muscles back here have to grab on and hold the weight of the head. Next slide, please. All right, so now that we've checked in with our spine and our head and neck, I'm going to ask that you check in with your hands and your upper extremities. So for computer-based work, most of the time, we want the joint angle at the elbow to be at about 90 to 110 degrees. Approximate it, and of course, every workstation might be a little bit different. At this point, you might realize you need to adjust the height of your chair. Perhaps before your feet were on the floor, but now you're not able to open up that joint at the elbow. So it may require a little bit of an adjustment. And then we want your hand and your wrist aligned. So for that, imagine that you have a line right through the center of your middle finger, down through your wrist, and line that up. Do your best. If you have a particular difficulty with this, sometimes pieces of ergonomic equipment can be supportive in that. Also, there's a lot of things that we can do just by practicing and developing new habits around the way that we move in order to protect our joints. Next slide. Okay, remember I said that thing about the bowling ball? We'll insert that here. So now what I want you to do is imagine that you have a bowling ball in both of your hands. Now reach that imaginary bowling ball out away from your body, and you probably wouldn't want to hold a bowling ball at full arm's length for very long. It's a pretty good indicator as to how valuable it is to keep things close to our bodies. So if you have your arms right along your sides and then you sweep your arms in a windshield wiper type motion in that usual work version, I call that the green zone. So right there in that span, that's your green zone. Green means it's good to go all day long. And most of the things that we use for work, we want to position closely, very near to the body to decrease the risk of musculoskeletal strain. Again, sometimes reach can play into the aches and pains that we might feel. So things like your neck being sensitive, your shoulders being sensitive. And if you're really pulled forward out of that neutral posture, you might even feel it down into your lower back. So if any of those areas are talking to you, communicating to you, and giving you those warning signs, some of these checkpoints might help to alleviate some of that strain. Now, if you bump your elbows out away from your body, and again, you do that windshield wiper, out there in that mid-range, I call that the yellow zone. Here we've got it listed as occasional work. And anything that's in the yellow zone might be something that you intermittently access. I always think of the yellow zone as being a great place for your coffee cup, or maybe your cell phone, or any other thing that you might intermittently be accessing throughout the day, but that you're not constantly using. So that's that next zone. And then if you reach your arms out way ahead of your body, and again, windshield wiper out there, that I call the tertiary work zone or the red zone. Now, if you find that anything is out there in the red zone, that's really a time that we want to think about how we might relocate those objects. If they're way out there, we're probably not using them intermittently and certainly not all the time. And if you are, it's a time to either decide this is a stand and reach item, or this is an item that I need to relocate. So anytime that anything falls in that red zone, ask yourself, can I commit myself to making this a standing opportunity, or do I need to find another place for this to live? So take that quick check, scan your horizon, scan your environment, and be realistic with yourself. Am I going to develop a habit about getting up to go grab that thing that's over there anytime that I need it? Or is it time to create a new habit as to where it's located? Next slide. All right. So one more checkpoint. Basically, anything that's postural positioning in your workspace, most of the time comes down to two factors. It's the things that you have to see and the things that you have to reach. So mostly I've been talking about the things that you have to reach, at least in the last slide. And now I'd like to talk about the things that you have to see. And if it's computer-based work we're talking about, we're really talking about that computer monitor. And I think this is where a lot of people have fallen into some trouble, or maybe a little bit of sensitivity in their neck or shoulders or lower backs within the past year. Because it could be that you are working on a laptop, in which case your eye line might have dropped down significantly as compared to working on a desktop computer. Now, ideally, when we look out ahead of us, what we want is for the eye line to be within about the top third of your monitor. So one way of testing this, because it's really hard to see this from that outsider perspective, is to make sure that your spine is stacked, close your eyes, make sure your chin is tucked gently so that you're not looking up. And then when you open your eyes, evaluate, where did my eye line fall? And if it's within the top third of your monitor, then you're doing great, gold star. And don't worry, if it's not there, you can make adjustments. So if it's something that you don't have to access with your arms, let's say a computer monitor, and it's a little bit too low, you might put a book or a monitor riser, something to elevate that monitor so that your eye line is in the top portion. And if it's too high, well, is there anything underneath it? And if not, maybe it's time to adjust the chair again. So I hope I'm demonstrating to you already that all of these things cannot be taken in isolation. Each step of the way as you do your checkpoints, you're going to want to take a step back and reevaluate. Did that adjustment just throw off one of my other recommended joint angles? And if so, is there a solution? Okay, so let's talk about monitors. Now, I've walked into a lot of different computer workstations and seen a wide variety of numbers. Of course, I've seen one monitor, but I've seen as many as 5 and 6 monitors within a computer-based workstation. And so, of course, the idea of centering it in front of you works well when you have one, but what do you do when you have 2 or 4 Well, with that, what we want to think about is our distribution of use across all of the different things that we're using as our viewing targets. So if there is a primary monitor, we want to have that primary monitor be primarily in front of us. So if you have two and you use them perfectly equally, I would say, if you use them perfectly equally, we're going to center ourselves with a scene. And let's say that we have one that we use a little bit more, and then we shift the one that's a little bit more in front of us. Basically, we want to spend more time with less turn and less time with more turn. All right, so that might not be a perfect solution, certainly if you have 6, but evaluating how you use it is a good starting point. Now let's check in with the distance. Now with computers, we want them to be about an arm's length away and up to 1 to 3 inches beyond your fingertips. There's a lot of variability in monitor distance or depth away from us because vision is so highly variable. So it's kind of an iterative process. We want to start with that arm's length away, and then we're going to make adjustments based on your own individual vision and how it impacts your posture personally. Now, of course, this might be difficult also with a laptop. So this is why, best case scenario, if you're using a laptop, we want to use the laptop primarily as a monitor or with a docking station. And that's because those external inputting devices helps us to bring things a little bit closer in order to hit both reach and monitor position. Next slide. All right, so I've been talking to you quite a bit about all the things that you might do. And if you want additional, more personalized suggestions, I recommend that you Google USC ERGO, and that will direct you to the website that EHS has for you. And it has a great survey that spits out individualized recommendations. And if you find that those recommendations still don't help quite enough, you can request a visit. And an occupational therapist like myself or one of my colleagues will be happy to help you and make personalized recommendations and work through each of these steps with you in a step-by-step fashion. If you have any difficulty, I know that some people have some difficulty accessing that website occasionally due to problems with their VPN. You can also contact our offices directly. Now, before I sign off, in case I didn't make it perfectly clear before, I want to encourage you to take pause, check in with your body, don't forget to stretch, and take plenty of breaks, because some of the best things that you can do for yourself around this subject is really about paying attention to what your body is communicating to you. Thank you so much.
Great. Thank you so much, Angela and Carla and Marissa. Great information. We have a lot of questions coming in. I see the presenters are answering a lot of them in the Q&A, but we have about 9 minutes now for a question and answer. So feel free to enter your questions in the chat or the Q&A, and I'll go ahead and start asking questions to our presenters. And let me see here in the chat. So someone's asking about the building readiness list. If their building is not listed, does that mean it's not ready? Or can you explain more about that list, Carla?
Yes, of course. So just want to let everybody know that this is taking some time. It's a weekly update. I mean, I think it's an everyday update. And part of the situation is some people didn't have their restart plan ready. And if you don't have your restart plan, then we don't know if you're coming into campus. So that could be it. There could be, issues in terms of equipment. So yeah, it can vary, but it should be, they should all be updated soon.
And then a follow-up question to that specific on the social sciences building. So if they see that their building is not listed and they're scheduled to teach a class there, will the class be moved to another building that might be ready, or what should this person do?
That I'm not sure, but I would suggest that you send a message to the EHS line and make that request, because it's very possible that maybe they haven't submitted their startup plans.
Great, thank you, Carla. And there's a lot of questions that keep coming in around where to get masks, the N95 masks. how to request one. Is USC providing a fresh one every day? So maybe just expanding on that for the rest of the audience.
Yes, so I'm going to ask Angela. I don't know if Angela's still in the call.
I'm here.
Oh, you're there. Okay, good. So maybe you can talk a little bit more about that, about the request.
Okay. So first, I'd like to say that N95s are not required. You can still have protection wearing your surgical mask or your face covering. But if you would like to request a N95, please go to our website under the Resource Center, so ehs.usc.edu, and then at the top of the page, it has Resource Center. And then from there, it's the Restart Planning, and you can request the N95. And what we'll do is you have to fill out a form just with you, provide your information, and then someone from EH&S will reach out to you to schedule a consultation, because we do have to have some paperwork and we do have to go over the process of how to put the N95 on and do a seal check and then properly remove it. So consultation is about 15 minutes, and we will schedule that time to your convenience, either coming here to our office or possibly going to your office. After that, we will give you a couple to take with you, and then at that point, after that, the department will have to order inventory from the bookstore to provide for you and others in your department.
Great, thank you, Angela.
Yes. Mm-hmm.
Let me switch to Marissa. I have a question for you, Marissa. So this participant is saying that they've tried all your suggestions, but on the laptop, it elevates the keyboard as well. And then they find themselves typing in an odd position. So any tips for those of us who might be in that situation with the laptop?
Yes, if you happen to find yourself on a laptop, I would say the very best case scenario would be to use external inputting devices. So an external mouse and an external keyboard would allow you to position the laptop as your monitor and use it for that function, which allows you to position the upper extremity at about 90 degrees to 110 degrees at the elbow, and then assume that stacked posture with your spine and get that visual target of the computer monitor up at the appropriate height. Now, in lieu of that, something that you can do right this minute that improves things is actually position the keyboard part of the laptop down at the appropriate height for your arms. And then you can use the strategy that we call capitation, where you tuck your chin, not to be confused with decapitation. You tuck your chin to look at a slightly downward angle, and that allows the muscles of the back of the neck and the head and the shoulders, as well as your lower back, all of that is a little bit better aligned. And so that's the best case scenario on a laptop if you're not using any external inputting devices. But those external inputting devices are fairly affordable for many people. If you don't feel like that's something that you want to afford to yourself, that might be a time to communicate with your department about that as being a need, especially if you're already experiencing any concerns there with those warning signs that we talked about before.
Great, thank you. Let's talk about cleaning. I'm sure we're all wondering about this. Angela or Carla, how often will we have to clean classroom spaces? And is there cleaning before and after? So I don't know if the person's asking if they have to clean personally or how often the university is cleaning. But any insight of that would be appreciated.
Go ahead, Carla.
Hi. So I would say, I know that we have moved our requirements from 3 times to, I believe, twice a day, and then to 1 time. It all depends on where we are with the COVID exposures. And I believe, what I do, I'm just going to speak for myself because I have a hotel cubicle. I always clean everything before I leave and when I come in the morning, because I just want to make sure that everything is clean for the person, and I hope that the person that also shares with me does the same. But it's something that I think you may want to create with your supervisors. That's why it's it's something you may want to communicate and create some kind of guidelines, especially for your own areas. I hope that answers the question.
Thank you, Carla. Here's another question. Any insights on this? What happens when you share an office with someone who uses public transportation? Any additional tips or thoughts around that?
Well, I would say that if you're that person is probably working, wearing a mask because that's a requirement. I don't think, that should not really make you feel afraid or not, right? You should continue to practicing like what we're saying, masking, vaccination, social distance, all those things. It's not just doing one thing that's gonna help us with everything. It's doing a combination of everything.
Great. And then just to clarify the question I asked earlier about cleaning, it's specific to classrooms. So I don't know if you have any information on classroom spaces.
Classrooms are being cleaned every day. I do suggest, as Carla already mentioned, that you have hand sanitizer in the classroom for people to use as they come in. You can direct them to sanitize their hands when they come in and when they leave. But all students are to wear a mask or a face covering, and they are required to be vaccinated. But cleaning is going to continue to be a daily cleaning that you are not required to do, but you can certainly do some additional cleaning if you'd like, but our facilities is taking care of that.
Great, that sounds great. And then the last question, since we have just a minute left, is a group's been told that they have to return to campus, which feels risky with the increase in the Delta variant. Is there support for requesting a hybrid return if the work does not require all to be on campus?
That's probably a human resource question. I know that people were able to work remotely for over a year, and if you were able to do your job effectively without coming to campus, personally, I don't see why that wouldn't continue. But different departments are making decisions on the return of the employees, whether it's a 5-day work week, whether it's 2 days a week, 3 days a week. This is all based on what departments have decided. So please talk to your supervisor or your human resource partner.
Great, thank you, Angela. Well, unfortunately, we are out of time, and I want to be mindful of keeping on schedule. So I want to say thank you so much to all our presenters and to all of you for attending the Healthy Habits webinar. We will be sending a survey to all of you to collect feedback about our presentation, as well as a PDF copy of the presentation. And just to preview our next 5th session taking place on August 12th, that topic will be on social reconnection. What changes, what stays the same? Featuring an expert panel with Quade French from Campus Wellbeing and Education and Chantel Young from Keck School of Medicine. So we hope to see you all there. Thank you, everyone, and have a healthy day.
Right on.